I'm Timothy Kosinski, DDS, from Bingham Farms, Michigan. The patient here is a 25-year-old male with no medical complications who presented with congenitally missing maxillary right and left lateral incisors, replaced with a removable partial denture that the patient found unsatisfactory. The Hahn tapered implant system, with its pronounced thread design and ability to accommodate tight anatomic spaces, was selected to restore the edentulous sites, as minimal horizontal bone was present. When placing dental implants, the dentist must be certain that the angulation, depth, and position of the implants are appropriate to allow for a natural emergence profile, which requires a comprehensive evaluation of the patient's bone volume and anatomy. Several techniques are available to achieve this goal. Here, a scan was made using the PACS i3D green imaging system from Vatech America. The sagittal view of the scan illustrates the amount of available bone. The amount and quality of bone was precisely determined with the imaging software. Virtual placement of the implants can also be performed, helping the doctor choose the proper implant size and visualize how the implant should be positioned in the edentulous space. Because the patient's anatomy in the edentulous spaces did not present any complications, the implants were placed without the use of a surgical guide. The case can also be predictably planned with conventional two-dimensional digital radiographs. Ball bearings of a known diameter, such as 5 millimeters, can be placed in the patient's mouth and used to calibrate DEXIS imaging software from DEXIS, which can then be utilized to record accurate radiographic measurements. This allows for precise determination of available vertical bone for dental implants. Horizontal dimensions can be determined using bone calipers or flapping the site to provide a visualization of the available bone and morphology. To create proper emergent profiles for the implant retained crowns in the maxillary right and left lateral incisor positions, the 2 millimeter pilot drill was centered between the teeth adjacent to the edentulous sites. The osteotomies were positioned approximately 3 millimeters palatal to the facial aspect of the adjacent dentition to allow for the best aesthetics and enough facial room for a custom abutment and implant retained crown. The mesial distal angulation of the drill was checked with a digital periapical radiograph. A tissue punch was then used, which removes the tissue above the osteotomy preparation, ensuring that epithelium would not penetrate into the socket. The Hahn tapered implant system surgical kit was used to create osteotomies slightly smaller in diameter than the 3 millimeter diameter implants chosen for this case. An implant length of 11.5 millimeters were used for the maxillary right incisor and 13 millimeters for the maxillary left incisor. The diameter, length, and tapered body of the implants were ideal for the limited space available. Additionally, the implants feature prominent threads, which aids insertion into the undersized osteotomy site. The ability to place an implant in a slightly smaller osteotomy can help ensure outstanding primary stability. This is especially important where bone quality is not ideal. Cover screws were hand tightened into position so the patient could continue wearing his transitional appliance during the healing period. After approximately 4 months, the implants were uncovered. Inclusive scanning abutments from Glidewell Direct were threaded into each implant and a digital impression was made. The 3M True Definition Scanner from 3M SB is a digital impression system consisting of a computer on a mobile cart and a compact, lightweight wand. The scanning wand is a handheld optical device that captures high-resolution video images in real time as the patient is being scanned. The digital technology captures clear and highly accurate impression data in minutes, without the need for traditional impression materials that some patients find inconvenient and messy. The creation of highly accurate images allow for fabrication of precise restorations that fit well with minimal adjustment. The 3M True Definition scanner used here produces open STL files, which means that the scans are easily exported to CAD/CAM systems in place at the lab. From the digital scan, the lab created custom zirconia hybrid abutments and BruxZir Anterior crowns to establish an ideal emergence profile. The BruxZir Anterior crowns were selected for their high aesthetic value and durability. The margins of the custom abutments were designed to be equigingival or just slightly subgingival, simplifying cement removal and eliminating the possibility of cement remnants creating periodontal issues. The BruxZir Anterior crowns were cemented over the custom abutments without difficulty. The final restorations created excellent function and aesthetic emergence profile. So in conclusion, when clinicians embrace the technology of digital scanning and CAD/CAM prosthetic design, efficiency and proficiency in the dental setting makes dentistry enjoyable and predictable.